Hello everyone, this is Dr. Saroswati from the platform of UKMLA with DSS. So let's just continue our ethical scenarios, and the topic that we are going to discuss today is the LGBTQ scenarios. Okay, so before I jump on to structure and before I start teaching a particular structure, let me just give you an overview of what type of LGBTQ scenarios are there and why they are tested. Okay, so most of the IMGs, they are coming from the background and they are coming from those countries, so the UK, where the concept of LGBTQ is not very popular and it is not widely accepted because of cultural and religious reasons. Okay, so the GMG is very well aware of the fact that it's a topic that these IMGs don't usually discuss, and it is something which is new to them. And more than being new, they know that we have some kind of hesitancy and we have some kind of reluctancy to talk about it, and it is also considered as a taboo in a lot of the countries where the IMGs are coming from. Okay, so they know that it's a difficult conversation for IMGs to have, and we haven't seen a lot of cases like these, and these cases do not very frequently show up to us in our clinical practice back in our home country. But in the UK, UK is very pro LGBTQ. In fact, NHS is very pro LGBTQ, and there are a few NHS trusts who have the multicolored LGBTQ logo in their logos as well, and they are very strong supporters of the LGBTQ aspect. Okay, and particularly about the mental health about of the LGBTQ group. Okay, so you need to keep that in mind that they're very very pro LGBTQ. Okay, so despite your cultural reasons and despite your religious reasons, for the purpose of the exam, you should be very confidently dealing with these cases, just for the purpose of the exam. But since a lot of you, after clearing the exam, inshallah, you may end up getting a job in the UK, and you may be practicing. But if you feel that you're not comfortable to deal with cases of LGBTQ, cases of gender dysphoria and problem with the sexual orientation, then you can always request to not take up those cases, and you can always request to avoid those cases. Okay, so it's not something that you have to do for the rest of your life. It's your personal choice at the end of the day. But if you are reluctant enough, then you have the choice of not dealing with these cases. But for the exam purpose, you would have to. Okay, there is no option. You cannot say no in the exam to a gender dysphoria or to an LGBTQ case. Okay, so just for the exam purpose, you have to act like a pro LGBTQ, and make sure that you don't give that impression that you are against it, because since you'll be working in the NHS, and the NHS is very very pro LGBTQ. Okay, so that's one thing. Other than that, there are basically two different type of scenarios which are typically LGBTQ aspect oriented. Okay, and both of them have a different structure and a different way to go about it. Okay, and then there are many different stations in which you would be dealing with the LGBTQ group, and they can come from any category. Like for example, the pediatric group. Okay, they can show up in any category. They can show up in the counseling station. They can show up in the dermatology station. They can show up in the abuse station. Okay, same goes for the LGBTQ group. Okay, they may just show up to you in the counseling, in the basic history taking, medical diagnostic stations. They may just show up to you in the abuse cases, and they may just present to you with a completely unrelated medical complaint, but they would be from the LGBTQ group. Okay, so you need to make sure that you are well aware that what are the questions and what are the key data gathering pointers you need to touch on when the LGBTQ group is just showing up in other different type of categories. Okay, and you need to be aware of the two structures. Okay, what are the two structures that you need to follow, and what are the two cases that are pure LGBTQ cases? Number one is the gender dysphoria case, and number two is the sexual orientation case. Okay, so we're going to discuss both of them one by one, and then after that, I am going to discuss what are the important data gathering questions that you need to ask in the patients of the LGBTQ group coming to you with completely different complaint that is not related to the LGBTQ aspect. Okay, or maybe related to the LGBTQ aspect. Okay, so let's just discuss, let's just start discussing it. Okay, the gender dysphoria case. In the gender dysphoria case, you may be in GP surgery, and a patient who is 15 years of age. Okay, it would be a boy or it can be a girl as well, but the age group would be between 13 to 16. Okay, and they would just present to you with some concern that have been bothering them. Okay, and you would have to ask about the history and address the concerns and do the relevant and do the management that is needed. Okay, so just like all the ethical stations, we're going to follow the 8 layer approach. Okay, and in the 8 layer, what you need to do is number one, in the very beginning, you're just going to start off with the station that, hello, I'm Dr. XYZ, and I'm an FI2 in this GP surgery. Am I speaking to this? And I can see, Peter, that you're here with some concerns. Can you please tell me more about it? Okay. And then once you do that, they would be very reluctant to open up. Okay. They would be very hesitant to open up. Okay. So they may not be giving you the typical non-verbal clues. Okay, but they would show some reluctancy, and they would show some hesitancy in opening up. And they'll be like, yeah, doctor, I am here with some concern. I don't know how should I say this, doctor, it's something really embarrassing. I don't know whether I should talk about this. I think just let's leave this conversation for today. I'll come to you some other day. Okay, our doctor, I'm not getting the words, and I'm not really sure how whether or not it's the right thing to say or not. Okay, so doctor, I don't know, and this is how they'll be acting. Okay, they would be very reluctant to open up, so they wouldn't be giving you the proper non-verbal clues, like it is in the psychiatry stations and in the abuse stations. Okay, but they would be uh, very reluctant and very hesitant. Okay, now what you need to do is that you need to be very reassuring, and you need to offer the support, and you need to be very very sympathetic towards the patient. Okay, just go like that. Okay, I'm here to help you. I can understand that you may be wanting to bring up a difficult conversation, but trust me on this, I'm here to listen to you. I'm here to address all your concerns. You can trust us with whatever is bothering you right now. uh, don't worry, we see hundreds of cases of different types every single day. And something that may be bothering you, and something that may not be normal for you is pretty normal for us. And it's completely okay to feel whatever you are feeling. I wouldn't be able to help you until you speak up about it, until you talk to me about it, or until you share some concerns with me, until you shed some light on whatever is bothering you. Okay, so you gotta be reassuring. Okay, just make sure that you make him comfortable, that please try to make sure that I'm only here to help you. I would not be judging you on anything. Okay, and we will try to help you in the best way that we can. Okay, be nice and be very very supportive of him. Okay, and then once you have made them comfortable, okay, that is what your rapport building is. Then the concern would be that I feel that I was born in the wrong body. Or doctor, I feel that I should have been born like a girl if there is a boy coming up. Or I feel that I should be born like a boy if there is a girl that is coming up to you. Okay. And then before moving on to the layer number two, you're going to say that well, it's completely okay to feel that way, and whatever you're feeling is not abnormal at all. A lot of people do believe this, and a lot of people do feel it this way, and that is completely all right. Okay, so you're going to make him comfortable. You're going to agree, and you're going to say that okay, that is completely fine if you're feeling that way. Okay, so you have to be supportive of it. Again, like I am doing it very confidently right now in front of a camera, because I've been teaching it, and I've been saying this all of these things like multiple times. Okay, but for the first timers, and for especially for the IMGs, um, who comes from a country and who comes from a religious background where this is not widely accepted, then it kind of get difficult, and it kind of get not easy to say all of these things, and that really shows up in your tone. Okay, that really shows that okay, you're not being very comfortable, you're not being very open and very supportive of it. So you genuinely have to kind of bring that thing in you, that okay, you support this thing very openly, like not endorsing it for like the general like beliefs. It's your belief, and like all of us, we respect your belief, but for the exam purpose, this is important. Okay, So just be supportive that I can understand that you are feeling this way, and it's completely normal to feel that you're born in the wrong body, or it's completely normal to feel that you have been born the wrong gender. Okay, so just for the exam purpose, you can say this and be very confident about it. Okay, and then you go like that. Okay, will it be okay if we can ask, if I can ask a couple of more questions, or if we can have a chat, so that I can understand your condition better and I can help you in a better way. Okay, and then you move on to the layer number two. Okay, so it's very easy. Just like the way there were six P's of the Hobbes gain history. Okay, there are six P's of the gender dysphoria as well. Okay, in the first P, what you're going to explore is basically the present. Okay, how are you living your life currently? Doctor, I'm living my life as a boy. I'm living my life as a girl. Okay, since how long have you preferred this gender? Doctor, I prefer that I want to live like a girl since the past 2 years. Okay, then how are you dressing up nowadays? Okay, how are you identifying yourself as of now? Yeah, doctor, I'm identifying myself as a girl right now. Or doctor, I am dressing up like a girl. I try to wear mini skirts. I try to put a female top so that I can look like a girl. Okay, so all of these things, how are you living your life currently? What is your preferred gender? How are you dressing? How are you identifying yourself as of now? So that is what the present is. Okay, how are they living their life currently? Okay, then past. Okay, what was your preferred gender in the past? Was it always a boy, or even in the past you had some thoughts that okay, you should have been a girl? Okay, and then you ask about that, how do you feel being a part of that particular gender? Like for example, in the past, if he was living like a boy, since he is a biological boy, so you got to ask about that, how have you felt being a part of that particular gender? And they would say that, yeah, doctor, it was kind of uncomfortable. I always had a feeling that something is wrong with me. Or they may say that, doctor, yeah, previously I was very comfortable being a boy, but over the past couple of years I feel that I should be like a girl, and I'm born in the wrong body, and I should have been a female. Okay, so that is what the present is, and that is what the past is. Okay, so the two P's. So now we move on to layer number four. That is your perception. Okay. Now, what is your perception about having breasts? What is your perception about having periods? Okay. Or if it's a girl that wants to shift to a boy, then you've got to ask about it. That what is your perception about male genitals? Okay. Then you ask about the perception that they have, like about their gender and how the particular gender dresses. Like, what is your perception about dressing as a boy? Doctor, I feel that wearing t-shirts and wearing pants and dressing up like a boy is something that is really, really cool. Okay, what is your perception about dressing as a girl? Doctor, I feel like that when I wear mini skirts, I look very, very cool, and I look awesome, and I look very appealing. Okay, so the next P, or the P3, is basically the perception. What perception do they have about the gender in which they have to transform, and what perception do they have about the gender that they are currently in right now? Like, let's suppose that if a girl wants to convert into a boy, so you got to ask about everything. That what is your perception about this particular gender that you're living in? Doctor, I feel like this gender is not something that I wanted to have. Okay, so you got to explore both the perceptions. Okay, that is the layer number three, layer number four, and P3. Okay, then preference. Okay, what is your preference? Okay, do you prefer to go to the toilet that is male or that is female? Okay, what color do you prefer? Do you like the girly colors? Okay, the typical girly colors like the pink color, or do you like to wear bold colors like black color, which is usually preferred by the boys? Okay, so ask about the preference. And these two aspects should be more than enough to judge the preference. That is the toilet preference. Okay, and the color preference. Okay, because the dress preference and all, some of these aspects you have already asked above as well. Okay, in the perception part as well. Okay, so it would get repeated. So even if you just ask these two questions in the preference part, that is completely fine, and you can skip it over here in the preference part. Okay, that which dress would you like to prefer, skirt or jeans? Okay, so just shorten down the questions. The sole purpose of mentioning it is that if you have missed it over here, then you can ask this question over here. Okay, so yeah, the fourth P was the preference that they have. Okay, and then comes the fifth P. Okay, like really important, the personal history. Okay, do you have any friends and family? Have you shared this idea with anyone? Okay, this is like really important. You gotta assess that what is the current situation that this person is completely feeling right now. Do they have any friends and family? Okay, is this person alone, because they are at a risk of developing lack of support and mental health illnesses as well. Okay, so you got to ask about them, that who do they have around. Okay, and have they shared this idea with anyone, because that this person was getting very uncomfortable to even talk about it. Okay, that's why they were very reluctant in the beginning. Okay, so you just got to ask in the personal history or in the layer number 6 that have you shared it with anyone, do you've got any friends, and have you got any family members who are aware of it. Okay, and then since UK is a multi national a country, like people from multiple nationalities come to the UK. Okay, and it's kind of like a global village. So you gotta ask about this thing as well, that is the idea that you just proposed, is it widely accepted in the community or the school logo? Okay, so you gotta assess that. Okay, like if it's widely accepted in the community or widely accepted in the religion that this person belongs to, because like if it's not widely accepted, then obviously they're going to get some backlashes, they're going to get some tough time. Okay, and they wouldn't have that kind of support. Okay, and in the management part, you would have to offer the support in much more detail. Okay, and what are the supports, I'm going to talk about it later on when I come to the layer number 8, that is the management. But you need to assess this to get an idea that what kind of support and to what extent do you have to offer the support to this particular kid. Okay, and then the psychological aspect, because these people, like even though LGBTQ aspect is very common, it is very well supported by the NHS and the UK. Even then, they prefer some bullying, they prefer some backlashes, and they prefer some resistance from a lot of group. It's still not widely accepted. So you gotta ask about the psychological aspect, and that is what you need to do in the P6 or the layer number 7. That is, how has this condition affected your mental health in general? Because this person has been struggling. They have constantly having the thought that they're wrong, they're born in the wrong body, and a lot is going in their minds. Okay, so you just ask about that. How is your mental health in general? Okay, and then you got to ask about have you ever been bullied because of your gender preference? And as I said, that even though it is widely accepted, okay, it's the acceptance is increasing in the UK, but still they have some resistance. Okay, and they're still not accepted by a lot of people in the UK. So there is a very strong chance that they might just get bullied, because just imagine a boy who's a biological boy, he's studying in the school. All the classmates have known him as a boy for so many years, and then all of a sudden he started basically wearing a wig, and he started dressing like a girl. There's a very strong chance that in the school they might get bullied. Okay, so you need to keep in mind the mental health aspect as well. And then you just ask about that, have you been bullied about your because of your gender preferences? Okay, and since they're bullied, since they have got mental health issues, okay, and there's a lot going on in their mind, there is a very strong possibility that they may have a thought of harming themselves. Okay, so you got to ask about that as well, that by any chance did you ever have a thought of harming yourself? Okay, so that is the psychological aspect. Okay, so always make sure that the person in the psychological aspect is always covered whenever you are dealing with the gender dysphoria patient. Okay, so until the layer number 7, it's all data gathering, data gathering, data gathering. Okay, the layer number 8 is basically the management. Okay, In the management part, it is like really really important that you explain what the patient is going through, okay, because they may not understand that what they are going through. They just feel that they're born in the wrong body or they're born in the wrong gender, okay. And you got to tell that, okay, okay, Peter, thank you so much for coming, and I really appreciate you being strong enough to come to me and come to us and open up about it. But what I would like to tell you that gender is a spectrum. One end is a male and the other end is a female, and it's completely okay to feel anywhere in between and oscillate between the two ends of the gender spectrum. So whatever you are going through is completely normal, and we are here to support you, and we are going to help you in every way possible. Okay, and that is what the explanation, and that is how the explanation would begin. Okay, and then you're going to say that, okay, so from the chat that we have had and from my examination findings, you may be going through a condition, a psychological condition or the condition of the mind, in which a person believes that they should have been born in the other gender, or they feel that they have been born in the wrong gender, and this condition is called the gender dysphoria. Okay, so the explanation is really really important. Okay, then uh, comes the referral. Okay, now since you are in the GP surgery, okay, and most likely the gender dysphoria case will present to you in the GP surgery. Okay, you will either going to refer the patient to the CAMHS or the GIDS or the GIRES. Okay, now what are these two things? I'll just share with you. Okay, so the CAMS or the Child and Adolescent Mental Health Service is basically it's a service that is there for specifically for the mental health of the children who are less than 16 years of age. Okay, so if there is any child, if there is anyone who is going through mental health illness, okay, and the child is less than 16 years of age, okay, then that particular child is always referred to the CAMS. Okay, and this is not just for the gender dysphoria, okay, but it is for a wide range of mental health illnesses that a child may present, which is childhood anxiety, PTSD, depression, ADHD, any eating disorders. Okay, so if anyone less than 16 presenting to you with mental health illness, they basically go to the camps. And since gender dysphoria has a lot to do with the mental health, okay, because it's all in the thoughts, it's all in the mind. Okay, it's the thought that is saying them that, okay, they should have been born in the in the other gender. Okay, so it's all related to the thought, and it's all related to the mental health. Okay, so for the children who are less than 16 years of age, like for example, this particular guy Adam White, okay, you refer them to the camps, okay, and then you got to explain them that right now what I'm going to do is that I'm going to refer you to the child, adolescent, and mental health service. Okay, there you would be seen by psychologist and therapist. Okay, and they are going to provide you with the psychosocial support, and we are going to provide you with the all the psychosocial help that you need to fight with your thoughts, and to make sure that you are completely all right, and make sure that your thoughts are aligned, and make sure that you're thinking in the right way. Okay, and then once you are after 16, okay, once you've crossed the age of 16, okay, or if somebody just comes to you who is 16 years of age, okay, then you refer them to a place called the GIDS, that is the Gender Identity Development Center. Okay, this is what the main place is. Okay, this is what is the solution for gender dysphoria. Okay, and just like the way we have one stop solutions for so many things, okay, the GIDS is the one stop solution for gender dysphoria. Okay, now what the GITS does is that since it provides a one-stop solution, what they do is that, number one, as I mentioned, that this is a condition that is psychological, and it has a lot to do with the thoughts. The GITS also provide psychosocial therapy, and the psychosocial support and the mental health support that a patient who is undergoing gender dysphoria they experience. Okay, so the first step in the management of gender dysphoria is basically psychosocial. Okay, then after the psychosocial, the next step is basically the hormone therapy. Okay, and basically the medical interventions. Okay, so that is the next step. So after the mental health counseling and the psychosocial support is provided, then you are seen by the healthcare professionals who basically put you on some medications like the puberty blockers, like different hormones, testosterone if you want to convert from a female to a male, and then estrogen if you want to convert from a male to a female. Okay, so all of these things, that is the medical intervention that is being done, and that is also done under the supervision of the GIDS, or the Gender Identity Development Service. Okay, and then once the hormonal therapy is completed, then the next step and the last step that the patient of gender dysphoria go through is basically the sex change surgery. Okay, in which the genitals are changed, breast implants or breast removal is done. Okay, depending on case to case. The vocal cords are modified to either make the voice even thinner or make the voice thicker. If they're converting into a male, then the voice will be thick. If they're converting into a female, they'll try to convert it into a smaller voice, into a softer tone and a softer voice. And then they are involved with sex therapist. Then they're involved with speech therapist. Okay, to provide them with the support that they need to make sure that they change the way of their living, and they completely transform from a male to a female, whether it's the voice, whether it's the hormones in their body, whether it's the genital. So a complete shift in gender, and the complete solution is provided by the Gender Identity Development Center. Okay, so it's a holistic patient-centered care. All right, so that is what the JITS does. Okay, and that is what the course of action is, and that is what the steps that are taken to manage the gender dysphoria. Okay, so whenever you are explaining that, okay, I'm going to refer you to the CAMS, I'm going to refer you to the JIDs, okay, always make sure that you explain all of these things. That once you go to the JIDs, you will be seen by healthcare professionals, you will be seen by psychologists. They're going to make sure that they counsel you, they talk to you, they try to assess the way you are thinking, and they provide you with the mental health and the psychosocial support that you need. And once that is sorted, they are going to start you on some medications, which would include some hormones and some medications like the puberty blockers. Okay, and once that part is completed, and once you are at the very end stage of your journey of transforming into a male to a female, then what they're going to do is that they're going to involve the plastic surgeons on board, and then they're going to perform a sex change surgery in which your genitals would be changed, your breast would be implanted, or your breast would be removed. And after that, you would be seen by a different therapist, like the sex therapist, to give you some sexual knowledge and help you in your sex life. And they'll also be seen by a wide range of multidisciplinary team, which would include a speech therapist and a voice therapist, to make sure that your voice is also changed. So in short, what the JITS is going to do is that it's going to provide you with a one-stop solution, and it's going to support you and take you from the very beginning of your journey to convert into a female from a male, or convert into a male from a female. Okay, so that is how you need to explain it, and that is the detail that you need to drop when you're explaining the CAMs and when you're explaining the JITs. Okay, so that is what the referral part and the management part was. Okay, the advices needs to be there, like the advices like needs to be there in a lot of detail. Okay, and the advice that you would give would be to join on support groups. Okay, and check the LGBTQ foundations. Okay, there are some LGBTQ foundations, like for example, you can see over here that the LGBTQ Foundation UK is basically a national charity. It is funded by the government, and it provides advices on everything. Okay, and this basically focus on the well-being of the LGBTQ individuals, whether it's the mental health support, whether it's the sexual health advices, like I talked about the sex therapist, whether it's counseling, CBTs, whether or not they're going through any legal issues, if they're going through abuse, okay, if they're going through any mental illness, each and everything. Okay, it's a proper support group in which they combine all the LGBTQ people together, and together they support each other, and they're supported by the government as well, and they're supported by different facilities that are provided by the government. So the LGBTQ foundation is a like really really essential foundation that you should be aware of, and that you should name whenever you are providing the advices. Okay. And then we've got the Foundation, that is a gender identity research and education society. Okay, which basically provides support to these people, transgenders, LGBTQ aspect, non-binary people, and it's much more academic related. Okay, in which they talk about education and research, and they try to involve them into the education aspect, try to work on their employments. Okay, so somebody, if they're going through all of these things, if somebody is struggling because of their gender identity, okay, then the Guys Foundation helps in those regards. Okay. uh, then there's a foundation called the Gallup, which basically, again, it is for the LGBTQ people who are basically affected by the abuse, and who are, undergoing discrimination. Remember, I talked about the possibility of, bullying. We asked about the question that are you bullied at school, okay, or is it widely accepted in your community, and how is your mental health in general? Have you shared this thing with anyone? Because they're like, they get a lot of hate, and they uh, are basically exposed to a lot of violence, domestic abuse, sexual violence. Okay. And they're often forced to convert back to the gender. Okay, and it's a lot of societal pressure and the cultural pressure that they go through. And to tackle that, the UK has made a foundation called the Gallup. Okay. And again, it's a NHS funded, it's a UK government funded organization. Okay. So you should be aware of these foundations: the LGBTQ, the GIRES, and the Gallup. Okay. And whenever you are giving the advices, make sure that you talk about these support groups, and you talk about these LGBTQ foundations. Okay. And then you can just offer psychosocial support, offer talking therapies, and talk about psychologists. Okay. So you see, the medical aspect is not that much involved in it. Okay. It's mainly the psychiatric aspect, and basically you have to act, and you have to think like a psychologist over here, more than being a doctor. Okay. Because if you just talk about the medical aspect, it's just the hormonal therapies, and it's just the puberty blockers. Okay, that would be given by the jets. Okay, that is all the medical knowledge that you need to have. Okay. But over here, you need to think more like a psychologist, be very assuring, and be very very what do I call it, very supportive of their idea. Okay, even if at the back of the mind you don't support the LGBTQ foundations, that's fine. Okay. But for the exam purpose, you need to be very very supportive of it. Okay. So yeah, that is the structure that you need to follow for the gender dysphoria case. Okay. Then the next case is basically sexual orientation. Okay, this is another typical LGBTQ case. Okay. And let's just go through it. In this, a patient would come to you, and again the concern would be same, that there is some concern that have been bothering me. Okay. So again, you got to follow the 8 layers, and in the very first layer, when you say that, okay, can you please tell me what is your concern and what is bothering you? And again, they would not open up. Okay, they would be very hesitant, and they would be very reluctant in opening up, and you need to provide them with the sympathy and the support. Okay, in the same way that you provided to the gender dysphoria guy. Okay. And in this case, the concern would be that, doctor, I think that I am in love with one of my female friends, and I am attracted to her in a sexual way. Okay. And this is something that is bothering me, and I feel that, am I doing something right? Am I doing something normal? Is it all right to feel this way? So I'm kind of fighting with my thoughts about this. Okay. And I'm having a lot of thought war that is going in my mind about this. Okay. So this is what the concern would be. And just like the way that you offered it to the gender dysphoria guy, you got to offer the support to them as well, that it's completely okay to feel this way. This is not something that is abnormal. We have seen hundreds of cases like these, and a lot of people feel the same for the other people of the same gender. and a lot of people are sexually attracted to the same gender, and it's completely okay to feel this way. This is like really really common, and it's completely all right. Okay. And then you got to say like that, okay, will it be okay if we can have a chat, so that I can help you in a better way. Okay. And then you're going to start off with the data gathering. Okay, that is the layer number two. Okay. So you just ask about the partners, in the layer number two, that okay, who is your partner, since how long, did you get a chance to talk to your partner about your orientation, or did you just get a chance to talk to your friend about your orientation. Okay. And then very very important question that you need to ask, that what is your partner's orientation. Like, fine, you're attracted to another female, but is she also attracted to you in the same way? Is she also thinking about the sexual orientation in the way that you are thinking? Okay. So just explore about the partner. Okay, who, since how long, have you ever had a chat with her or with him? Okay, and what is their orientation? Okay, that is all about the layer number two, in which you need to discuss the details of the partner. Okay, it's like very simple. The layer number three is basically details of the sexual orientation. Okay. And this is what the cornerstone of the data gathering would be. Okay. That since how long have you been attracted to the same gender? Okay. Doctor said 6 months, 6, 7 months, and 8 months. Any particular reason that this change occurred? Okay. And then you are asked that, did you ever have a thing for the gender of the same sex in the past? Okay. Let's suppose if the girl is 25 years of age, and then she says that I've been feeling, the attraction towards the same gender for the past 5 years. So, what was your gender preference in the past 20 years that you spent? Okay, was it the same for the similar gender, or was it there for the opposite gender as well? Were you heterosexual before, or were you homosexual? Even like from the day you got your puberty. Okay, are you having those thoughts since the time you had your puberty, and since the time you started having feelings, or having sexual feeling for someone? Okay. And then another important question that you can ask is that, what do you feel about the other gender? Okay, because there is a very possibility that the patient may be bisexual. Okay, and not homosexual. Okay. So ask about this question. Many people miss out on this question because they just blindly assume that, okay, she is going to be a homosexual, because she came to with the complaint that she is attracted to one of her female friends. Okay. But there is a possibility that this patient is bisexual. Okay, so you got to ask about it. How do you feel for the other gender? Do you equally feel sexually attracted to the male and to the females, or do you just feel sexually attracted towards the female, and you have got no sexual inclination towards the males? Okay. So this question is like also really really important, just to rule out the bisexual aspect part. Okay. Then you got to ask about the psychosocial support, because as I mentioned that they are going through a lot mentally. Okay. So do you have got friends and family available? Have you ever tried to talking to them about it? Have you shared this idea with anyone else? Okay. Then how is your mood in general? Okay. And when you ask about the mood, and you ask about the mental health, you also ask about the risk of self harm. Okay. So all of those questions that we already know, that what to assess in the psychosocial aspect. We've been discussing this throughout the course now. Okay. And then you can ask that, okay, have you joined any LGBTQ foundation? Have you taken any support from the government services that is there for the LGBTQ group, or that is there for the LGBTQ community? Okay. So yeah, in the first four layers, okay, these are the set of questions that you need to ask for your data gathering. These are the set of questions that is going to make up your data gathering. Okay. And then comes the management part. Okay. In the management part, there is not a lot to do. Okay. There is no medical management. It's just reassurance, and the kind of suggestions that you're going to give to them, to make sure that they have the right support, and they are provided with the right psychosocial support that they need. Okay. So there is nothing, no rocket science. It's very simple, and what you would be awarded on is the way that you talk to them. Okay, what you would be awarded marks on is the way that you counsel them, is the way that you try to support them, try to reassure them, and try to make them comfortable. Okay, that is what is expected of you. Okay, so first of all, the reassurance is like really, really important. That it is okay to feel the way that you're feeling, because gender is a spectrum. One end is a male, the other end is a female, and it is okay to be attracted to anyone in between. Okay, it doesn't matter if you are a female and if you're attracted, sexually attracted to a female. That is completely all right, because you are not alone. What I would like to tell you that around 1.3% of the population in the UK are bisexual, which means they are attracted to both males and females. And 1.5% of the total UK population are homosexual, which means that they are attracted to the same gender. So you see, you're not alone, there are other people as well. Okay, so do not feel that this is something abnormal. Do not feel that you're doing something wrong. That is completely all right to feel the way that you're feeling. Okay, so throw these stats. Okay, just review these stats. Okay, whenever you're giving your exam, because it keeps on changing. But just throw these stats and just let them know that they're not alone, and you are there for the support, and there are so many other people who are going through the same issue, and there are other people in the UK who belong to the same group as well, and who have been facing the same issues. Okay, then you gotta give the psychosocial support. Okay, that okay, I understand that this can be mentally challenging, and I understand that you would have to fight with your thoughts that may be coming, that whether or not this is right or not. What I can do for you, because like you are a doctor at the end of the day. Okay, and as I mentioned that this is more of the psychological aspect. Okay, so always refer the patient who is having some issues in their sexual orientation. Always refer them to the CBT. That what I'm going to do is that I'm going to refer you for CBT or for talking therapies. Okay, where you can go and then just have a conversation with your with the psychologist or with the psychotherapist. Okay, and they will also help you in dealing with your thoughts, and they will also help you in your mental health in and in the way that you're thinking. Okay, so that is like clear number 6. Okay, then you talk about the support groups. Okay, I've just talked about the support groups in a lot of detail a couple of while ago when I was discussing the gender dysphoria. Okay, talk about these support groups. Okay, mention them and tell them what they do, and don't mention Gallup, because Gallup is for particularly for the abuse aspect. But if they are going through any abuses, if you find in the psychosocial aspect that they have any um, episodes of abuse because of their sexual orientation, then you may just mention about the Gallup. But talk about the Guys Foundation, talk about the LGBTQ Foundation. Okay, wherever it is needed. Okay, and then encourage them to talk. Okay, this is also like really, really important, that you ask them to get the psychosocial support. You ask them to share their ideas, share their concerns with the people. Okay, and the most important person is the partner. Okay, because they're attracted to this partner, and they don't know whether or not the partner feels the same way, whether or not the partner knows that they feel the way that they're feeling. Okay, so make sure that you ask them to share it with their partners, share it with their parents, share it with their friends and family. And when you say that, they're going to be very reluctant, and they're going to say, no doctor, I cannot share it with them. They're going to hate me, they're going to kill me, they're going to not find it very, very good, and they're going to consider me as not a good person. Okay, and I cannot share this thing with my parents, and I cannot share this thing with my family and my friends. Okay, and you gotta just reassure them that no, it's completely okay. The parents do understand their kid. Okay, and the friends also do understand the feeling. Okay, it's just that you need to explain to them. I'm pretty sure that they will come around, and they will just understand that whatever you're feeling is completely all right. But it's always better to have people on board with you. It's always better to have the support of your friends. It's always better to have the support of your family members with you. Okay, so I would still encourage you to have a chat with your parents. Try to talk to them one by one, and try to explain them whatever you're going through. I'm pretty sure they may just get angry in the beginning, but eventually they will understand, and eventually they may just support you. They may just understand and help you in whatever you're going through right now. Okay, so be very very supportive, and try to encourage them to talk. Okay, and as you can see that the four layers. Okay, I've divided the management part into four layers, and the only reason that I've done that is because you need to explain, and you need to get into all of these layers in a lot of detail. Okay, you cannot just just mention things and just move on, because there is nothing else to do. Okay, there is no other management that you can do apart from being the psychologist, apart from giving the psychosocial support, apart from counseling the patient, apart from explaining all of these things to them in a very nice and a very very supportive tone. That is all you need to do, and all of it needs to be done in a lot of detail. And that is why I have mentioned it different layers, because so that that okay, you need to cover each and different aspects separately and in significant amount of detail. Okay, so yeah, that is what the sexual orientation case was all about, and these two cases are the pure LGBTQ cases. Okay, uh, now what you need to do is, what you need to understand is that the LGBTQ aspect may be tested in other cases as well. Okay, and the other variations of the LGBTQ cases, in which the LGBTQ aspect would be tested, but there would be other pure medical cases. Okay, like for example, a patient may just present to you with UTI, and they would be a transgender, and they would be having UTI because they would be holding the urine for too long because of the fear of public toilets. Okay, so typically they would just present with burning micturition and maybe lower abdominal pain. Okay, so you would have to follow the medical diagnostic approach, and eventually you would find out that okay, they are transgender, and okay, that's why they are not holding they're holding the urine very very long because they are afraid of using public toilet. Like for example, they are a male who is dressed as a female. Okay, and they are like very hesitant to go and use the public toilet because but, like down there there's something else, and physically when by the looks of it they are a completely different gender. Okay, so by because of the fear of being judged, they avoid using public toilets. Then somebody may come to you with pulmonary embolism or headache because they may be just taking doing self medication of estrogen and progesterone, because their appointment to the general and development center would be delayed, and they may just have some problems with that, and they just start taking the estrogen and testosterone unprescribed and without any doctor's consultation, because they are in a hurry of changing their gender as soon as possible. Okay, and then there are a couple of counseling sessions that may just come to you, and in which there might be a lesbian who wants to conceive, and then you would have to talk about the other conceiving options like IVF and surrogacy. Okay, and then there's another case in which the lesbian may just come to you, who would be worried about and who would be concerned about getting a pap smear done. Okay, and their concern would be that okay, I'm a lesbian, why do I need to get the pap smear done? And then you would eventually have to explain it to them that okay, fine, you are a lesbian, that is fine, but still you're a biological female, and cervical cancer is common in all these sub biological female. Okay, so we need to screen you for that, and that's why we need to get your pap smear done. Okay, and then there might be some abuse cases in which there would be a gay couple who would be involved in abuse. Okay, so you may have to talk to them, and you may have to address their concern and manage their condition. Okay, so these are like not the pure LGBTQ cases. Okay, the problem with this is that okay, whenever the candidate, whenever plabdo candidates, whenever they see an LGBTQ group, okay, they completely miss out on all the important things of the cases, and all they start focusing on is the LGBTQ questions. Okay, and what mistake that they do is that they start doing the six P's. Okay, that is taught in the gender dysphoria, and they start asking about the questions of the sexual orientation cases. Okay, and that is where they go wrong, because it is not a pure LGBTQ case. There is a completely different aspect involved to it as well. Like for example, it can be a medical diagnostic aspect in which you have to come to the diagnosis. It can be a counseling session in which you have to, explain a lot of things. Okay, so you do not have that much time that you start, asking the 6 P's of the gender dysphoria, or you start asking about the um, questions of the sexual orientation, that who is your partner, what was your preferred sexual orientation before. Okay, you cannot go into that much detail. Okay, so always remember this thing. I'm going to give you 3 questions. Okay, these 3 questions are like really really important. Okay, and you just ask these questions whenever you find a LGBTQ aspect in a separate category. Okay, just these 3 questions should be more than enough. Like for example, in the pediatric cases, remember we had the P bind, in which we ask about the past medical history, the birth, immunization, nutrition, and development. Okay, so there were like 5 things in the pediatric aspect that you were asking despite the category, whether it's a derma session, whether it's a counseling session, you used to do the P bind aspect. Okay, similarly for the LGBTQ aspect, there are 3 questions that you need to ask. Number one, if they are changing their gender. Okay, you're going to ask that at what stage of the sexual transition are you currently at. Okay, so they're going to answer this question that, okay, yeah doctor, I am currently taking psychosocial therapy. Yeah doctor, I am currently taking some medications. Yeah doctor, I am taking some hormones, or I'm currently on hormonal therapy. Okay, and then you got to ask them that, okay, or maybe they just say that, doctor, yes, I'm done with my hormonal therapy, my hormones have changed, and now I am going through a sex change operations. Okay, so you got to assess that what stage of the sexual transition they are currently at. Okay, then you assess the psychosocial aspect, that do you have got friends and family, do you have got support available, are you part of any support groups, or are you part of any LGBTQ foundations, are you well supported, or do you have enough support available of your friends and family, is your friends and family aware of it, how do they respond to it, and what are the issues that you have to face because of your transition or because of your orientation. Okay, so the other aspect that you need to touch is the psychosocial aspect. Okay, and the third aspect that you need to touch is basically just the mood. That, can you please tell me how's your mood on a scale of 1 to 10? How's your mental health in general? By any chance, have you had any thoughts of self harm, or by any chance have you been bullied, or by any chance have you feel that you have always been at a disadvantage because of your sexual orientation or because of your gender transition? Okay, so just these 3 questions that you need to ask, nothing more than that. Okay, so whenever there is an LGBTQ group in another kind of a case, in a counseling station, in a medical diagnostication, or in a domestic abuse station. Okay, do not go into the 6 P's. Do not just ask about the sexual orientation questions. It's like you ask in the typical gender dysphoria and the typical sexual orientation case. Just these 3 questions should be more than enough. Okay, to award you the mark that is required to, do the data gathering, that is the LGBTQ essentials. Okay, so the stage, that is the first thing, then the psychosocial aspect, and then the mood and the mental health. Okay, just these 3 questions, and do not make the mistake of completely losing your focus and start focusing on the things that are not that important. Okay, so yeah, that is what the LGBTQ aspect is all about, and it can be particularly challenging, as I mentioned earlier on. But if you're able to stick to this approach, if you're able to stick to the structure, if you're aware of the things that I just taught you in this lecture, and if you're aware that what are the questions that you need to ask in the station which are not the pure LGBTQ. Okay, then you would be good to go, to be very honest, and there wouldn't be a anything that would be left to address in the gender dysphoria or the sexual orientation or the cases in which the other aspects of the LGBTQ is being tested. Okay, so that's pretty much it from my side. If you've got any questions and any queries, then drop them down in the comment box below, or you can drop them down on the social media as well. I would love to address all your concerns and queries. And if you want personalized mock, then scan the QR code and visit the website for more details. That's pretty much it. See you in the next lecture.